I think the present system that we have in place doesn't really fully meet the needs of patients. Patients aren't ill during office hours only. Patients become ill at all hours of the day and night and weekend. And I don't think it's appropriate to have inadequate access to healthcare after 5 or 6 o'clock in the evening and at the weekend.
It's amazing how often in our case things happen at weekends almost as if by pure bloody mindedness sometimes. It's nothing to do with the way things are. You can't even contact your own GP at the weekends. You get put through to whatever it is. And I tried, when Josephine was going through a very bad patch, one weekend, that was at the weekend, and I was put through to some medics at Carlisle. And they said, we can't do anything. Well, one wouldn't expect them to do anything from Carlisle, 60 miles away from here. I can do nothing until Monday morning. And everybody's phoning that person or those persons on Monday morning, so it's difficult to get through.
Unfortunately, mental health problems don't respect 9 to 5, and actually most young people end up having crises out of hours, often late at night or in the early morning.
I regard myself as an empowered patient, so I can navigate the system fairly well usually. I felt that the approach to 7-day care provision over the bank holiday was chaotic, and it's difficult. I have excellent specialist nurses, except for in a crisis. And if you ring the specialist nurse helplines, actually the message says they will not get back to you.
There was no 7-day service at all. Monday to Friday and weekends, they were just, you know, there was no continuation of care at all. So if somebody had physio on the Friday and it had helped them, they couldn't possibly, you know, there was nothing there. And then the following Monday, so whatever they'd learnt to be able to do, they couldn't continue to practice that. And there was just nothing, you know, there was no OT service and no physio.
Because I don't feel that I can access 9 to 5 services. My other option is to go private or to pay for charity to have counselling, but unfortunately I can't afford this even with working full-time, so I'm in a catch-22.
I was in hospital with acute renal failure and had been told that I needed to have a bone marrow biopsy, and it had been scheduled for 2:30 on a Friday afternoon. So I was wheeled down on a wheelchair, wasn't feeling terribly well, down to the haematology unit where the procedure was due to take place. The doctor went away to make the phone call and came back and said that the staff in the lab where the sample was going to be processed had gone home for the weekend. And you know, I was really angry because this wasn't even evening or weekend. Everybody was being stood down that afternoon, and it seemed to me that the dots weren't really being joined up. We had one part of the hospital all geared up to do something, and the procedure couldn't happen simply because another part of the hospital had essentially finished work for the week.
And she needed an MRI scan, and that's when the problems really began, because there was nobody in the hospital who could perform that MRI scan. They said to us that there was a waiting list, and the MRI was essential to sort of go ahead with the surgery to remove the cyst. It was quite a large cyst, the size of an inflated balloon. For the whole time she was in hospital, she was in incredible pain, constantly on morphine. Basically we had to wait 5 days before she could get that MRI scan that she needed.
The surgeon, after examining me, looking at the blood test results, decided that the priority was actually to get a colonoscopy and biopsies done and a CT scan done. So I was actually prepped for the colonoscopy, sent to the colonoscopy unit, and then when we actually came for me having the colonoscopy, I couldn't do the biopsies. because there wasn't a CSSD pack, and CSSD doesn't work on a Saturday or a Sunday or a bank holiday, so that was taking us to the Monday, and I needed treatment before then.
I work 9 to 5 now, but I also do a 3-hour commute every day, so I tend to be out the house from 7:30 in the morning to 7:30 in the evening. And unfortunately, the mental health services in my area are only available from 9 to 5 during the week. So because of that, I had a very stark choice to make when I decided to start my job, and that was, do I stay in treatment and take time off work on a weekly basis and have my employers very aware of this, or do I stop treatment now and try and just focus on the job? So for me, personally, I chose not to have treatment, although it didn't feel much like a choice. Some of my medications, I need to see my GP before she'll prescribe them again, and so that involves obviously getting a GP's appointment, which is unfortunately a lot easier said than done with my surgery. Some of my medication I can get on repeat prescription, so that's a lot easier because I don't actually have to make an appointment. But often I do have to see my GP before getting medication. And for me to see my GP, I have to take a morning off, or at least sometimes even a whole day off work. It's very difficult to get through to my GP in the morning, and even if I call up at 8 in the morning, I may not always actually manage to get an appointment that day, in which case I'm still late for work.
For me as a patient, 7-day working in hospitals means that instead of just feeling as though I can only have access to healthcare during office hours, 9 to 5, which really is actually a relatively small proportion of the week, that I would have at least some access to healthcare in the evenings and at the weekends.
Well, we have this conversation about a parity between mental health and physical health, but actually for me 7-day working is about having a parity of esteem for each day of the week, and understanding that mental health, physical health problems don't respect 9 to 5, Monday to Friday, and actually we need services that are appropriate and acknowledge that.
I think the impact of using patients and their experience in terms of designing 7-day working is that essentially patients know what their needs are. They have experience of being ill sometimes in an evening and at the weekends, and having experience of the lack of access to care during those hours. So I think it's important that patients and patient experience is used in order to design a service which is more holistic in nature.
The impact that patients and carers can have on developing services is huge. And when I first discovered participation, it blew my mind. I mean, the idea that not only would someone ask about my opinion on the service itself, but actually care about the response was a really big thing for me. And over the last couple of years, I've done a lot of work in service development. And I find that young people's stories and, patient stories can be really powerful, and they can show professionals things that they might have missed before.
I think what's missing is senior physician and surgical input, and also access to diagnostic tests in the evenings and at the weekends, so that the system as a whole can still work during those hours.
We can't choose when we're ill, and we can't choose what services we get a lot of the time. So please try and see things from our point of view and see it through our eyes.